All right, Dr. Beck, let me ask you, when people get numbness in their legs and in their feet and all kinds of places and have some type of pain, lots of us are going to a chiropractor and to a physical therapist, maybe even to an acupuncture. And tell me about how that fits in. Is it the right thing to do? Sometimes, not always. Shed some light on it, please.
Well, certainly for a lot of muscle and skeletal complaints, chiropractic and physical therapy can be very effective. The thing you want to know, though, is exactly what's causing your problem. In other words, I want to know, do I have nerve damage? Is it just a muscle strain? And one of the ways to sort that out is to have the nerve testing done first. And once we figure that part out, then something like physical therapy can be a very effective tool to help treat the problem. But we want to make sure what's going on before we start treating it and make sure we know exactly what we're treating with the physical therapy or the chiropractic.
I see. And you do physical therapy in your facility, am I correct?
Yes, we do.
Yes.
We have a physical therapist on staff here and also a physical therapy assistant, and they work very closely with us on people with muscle and skeletal complaints.
Okay. So, but basically it's a little bit like with everything else in life. You got to know where you go. You got to have a plan. You basically got to know what the cause, the root of the cause is.
That's it. That's the key right now. Find out what the problem is first, then you can treat the problem more effectively.
And if there is no nerve damage, well, then that eliminated that particular thing, and then we can work on the muscles and on the other stuff with great ease, not knowing we're overlooking something, knowing we're not overlooking something. Am I correct?
That's correct. We're not missing some permanent nerve damage or some type of severe nerve damage going on that could be treated with a different type of procedure.
Good. All right. We're going to go into a little bit later in another section of like if and when the nerve is damaged, what does that indulge of fixing? Obviously, as more sick as we get, as more, as more it takes to fix this thing, and probably lots of people are probably wondering, okay, so once I find out, what does it take to, once I find out that my nerve is damaged, what are some of the things we need to do? But we talk about that in another section. Thanks for now.
Okay, thank you.
Welcome.